Welcome back to Living Local. If you're looking for an effective way to improve your health or lose weight, it might be time to consider working with a registered dietitian. From portion sizes to what types of food you choose, Rock Valley Health can help you understand your body and how the foods you eat might affect it. And joining us today is Lauren Zust, a registered dietitian with Rock Valley Health, which is also this segment's sponsor. Welcome to the show. Thanks for being here, Lauren.
You're welcome. Thanks for having me.
Okay, so talk to us a little bit about Rock Valley Health and how it's different from Rock Valley Therapy, because a lot of people are more familiar with the therapy part.
Sure, yeah. So Rock Valley Physical Therapy is a pretty common name here in the Quad Cities, but our Rock Valley Health team, we are a division of Rock Valley Physical Therapy. So including myself as a registered dietitian, our team members have a variety of health and wellness backgrounds, from things like nursing, personal training, and certified health coaches. So we provide a lot of different corporate wellness services to a lot of different businesses locally here in the Quad Cities, as well as businesses across the United States. And a lot of these corporate wellness services include things like annual health screenings, personalized fitness testing, access to an online health and wellness portal, and monthly health coaching sessions, in addition to personalized nutrition sessions with myself as a dietitian.
Okay, yeah, I was going to ask you what kind of services you offer as a dietitian. So that's just a few, I'm guessing.
Exactly,
right?
Exactly, on a bigger scale with our corporate wellness focus. But individually as a dietitian here in the Quad Cities, I do provide one-on-one nutrition education sessions at a couple different Rock Valley Physical Therapy clinics here in the area. Okay. So a lot of the focus of my individualized consultations are on things like weight management, nutrition counseling, and something called medical nutrition therapy. Yeah. And medical nutrition therapy specifically involves a nutrition prescription for specific conditions that someone may have, things like diabetes, high blood pressure, high cholesterol, a variety of gastrointestinal conditions, and food allergies. Okay. And these things likely require a variety of specific dietary interventions to manage these health conditions successfully.
Okay. What can someone expect when working with a registered dietitian?
For sure. So when you meet with me for the first time, most of my individualized consultations are a 1-hour session, and I learn a lot about kind of what your medical and health history is, what medications you're on, different kind of supplements, as well as kind of the big picture of your overall wellness. So things like, what are your sleep habits? What are your activity habits? As well as stress management, because all of those things really do tie into making nutrition changes and healthy changes overall. Yeah. And then anyone who meets with me initially, I do ask that they can complete a food log for about 2 to 3 days, just so I can get an idea of, okay, what are their general eating habits like, and then from a medical nutrition therapy perspective, kind of applying those nutrition interventions to their current eating habits. I'm all about making realistic, healthy swaps, so working with them directly and providing that nutrition education that's realistic for them, so that they don't think they need to overhaul their lifestyle completely. Right.
That makes a big difference, doesn't it?
Sure.
So how is a registered dietitian different from, say, a nutritionist?
This is something that a lot of people don't actually realize, how much education goes behind being a registered dietitian. Right. Actually, as of January 1st of this year, all incoming dietitians now have to complete a master's degree, and this also includes a dietetic internship component. And then once those things are completed, you have to sit for a national board exam, and then depending on what state you choose to work in, there is state licensure involved, and then continuing education hours. So in terms of a nutrition profession in general, registered dietitians are really the main nutrition experts and the only licensed medical professionals that are able to provide safe recommendations for nutrition to the public.
Yeah, I think a lot of people don't realize the background that goes into being a dietitian. What are some of the most common conditions and questions that you receive from clients?
For sure. So number one is weight management.
Of course,
a lot of people struggling wanting to lose weight. So I do meet with clients for weight management more on a monthly basis, just to provide that accountability and motivation to keep going and develop those healthy habits, because I always say slow and steady wins the race when it comes to weight loss.
I love that.
And then I also work with a lot of diabetics, whether you are newly diagnosed with diabetes or your numbers are just kind of creeping up and your doctor recommends that you see a dietitian, or a lot of people who are pre-diabetic, kind of just preventing that diabetes diagnosis. And then I also work with individuals with a variety of gastrointestinal conditions and food allergies that need need to alter their diet for those reasons.
Okay, walk us through the process if someone is interested in dietitian services with Rock Valley Health.
For sure. So it's a pretty easy process. I meet patients in an outpatient setting at, like I mentioned earlier, 2 of our Rock Valley physical therapy locations here in the Quad Cities. One on the Iowa side at the 5 Points Clinic in Davenport, and then the Rock Valley Physical Therapy Clinic in Moline on Avenue of the Cities. So a couple different options for both the Iowa and Illinois Quad Cities. You can call those clinics directly to schedule with me, and there are also a variety of telehealth options available if you're not able to schedule with me in person.
All right, well, sounds good, and it was so nice meeting you, and I love hearing about, you changing lifestyles in people's lives with your services. So thank you for that, and thank you for coming in and talking to us today.
Thanks for having me.
All right, again, this segment was sponsored by Rock Valley Health, and for more information, you can visit their clinic in Davenport, located at 1700 North Division Street, Suite 200, or just give them a call at the number on your screen. You can also find them in Moline at 3800 Avenue of the Cities, Suite 107, and the phone number in Moline is right there on your screen, 309-743-0106. We'll have all those details posted on ourquadcities.com.